Welcome. This is the Health and Wellness Coach Journal podcast. I'm your host, Dr. Jessica Singh, the founder and CEO of the Center for Health and Wellness Coaches. This is a podcast for coaches to explore topics related to health, wellness, and coaching, sharing knowledge and sharing light. Liz Kiniry is a National Board Certified Health and Wellness Coach with a focus on clients who have multiple sclerosis. She works alongside her clients to help them build confidence and resilience while navigating their new wellness path. Liz is also a classically trained chef and a mother of 3. Welcome, Liz.
Nice to see you, Jess.
It's so wonderful to be here today and to have you here and to learn from your experiences. What led you to being a coach?
Well, I've always had a big interest in health and wellness. And as a chef, I learned how to do everything, but I sort of started to funnel my skills into more of that health and wellness area with everything I was cooking or baking. And then COVID hit, and I had a really big reevaluation of what I wanted to do with my career. And I thought about it and decided that I wanted to move away from being a chef a little bit and try something different. I had experienced the loss of my mother-in-law due to chronic disease, and my dad, I lost him in 2020 due to decades of chronic disease. And I just started to learn about this health and wellness coaching world, and it seemed very intriguing. I investigated it, and I found a program that was perfect for me, that I knew I was able to handle with my family life and other commitments. And I did it and didn't really know going in what I was going to do with it when I came out, but eventually led to working with folks with MS. I landed a job with the National MS Society for a brand new pilot that they were starting about a year and a half ago that was meant to help newly diagnosed people with MS. And somehow they picked me to be one of their coaches. And it's been a really exciting journey ever since. I've worked with them, and I also have clients on my own in my private practice.
Thank you for so authentically sharing your journey and honoring the experiences that you've had that brought you here and the loved ones that are no longer with us.
Thank you.
I'm excited to learn more about your work with the National Multiple Sclerosis Society, and I'd love to know, how did you find this opportunity? It sounds wonderful.
Well, as a nationally board certified health and wellness coach, I tried to stay aware of the national board's communication, and I got really lucky. I happened to see a posting for this job on the job board the day it came out, and I kind of dropped everything because it seemed like a great opportunity. And I looked at it and thought, I really don't have enough experience, but I think I have enough experience to do this. So I dropped everything and got my resume done and a cover letter, and I applied for the job. And then it eventually led to me getting the job.
I'm grateful to the National Board for Health and Wellness Coaching for their work and also providing these resources for those who are certified, like their job bulletin, which, as evidenced by you, ends up having life-changing opportunities. And obviously things have to fall into place, but it's wonderful because of those standards they're setting. Their new standards, that it's becoming the gold standard for health and wellness coaching, and really what that credential of being a National Board Certified Health and Wellness Coach signifies.
Yes. And after having had some really rich, good experience working as a health coach, I'm so grateful for the National Board to have this standard, because it really is important to stay within your scope of practice and stay within the guidelines that they set. So you have that gold standard of service that you provide to your customers and your clients. And the National MS Society saw a need for help for their people, and they went to the gold standard to find the people to help the members of the society.
May I ask you how? So I know you had mentioned at the beginning that you had applied and maybe you had felt that you hadn't had enough or as much experience as maybe others would have had who were applying for the position. How did you end up educating yourself and learning what you needed to know in order to fulfill this role as coaching with the National Multiple Sclerosis Organization?
Well, first of all, the society put out a wonderful training program and taught us everything we needed to know about the disease. And I also know people with MS, so I had a little bit of an idea of what it was all about. And so I was a little familiar with it, but I really got the training when I started. And honestly, the real training has come from meeting with people. There's only so much you can be told on a document or study, but really having those raw conversations with people every day and discovering their world through their eyes as they tell their story is really the best education you can possibly get. I am learning things every time I meet with my people, and it's really a special thing.
Such a beautiful description and your passion, learning about it from the people. I remember feeling that way in medicine all the time because it's not like you're reading about a disease or you're reading about something. No, these are real lives. This is humanity.
Yes. And one of the big things that we're taught as health coaches is really to actively listen. I'm not giving advice. I leave it up to the medical professionals, doctors, physical therapists, mental health professionals. They give the advice, but I'm working with my clients to help them figure out what to do with it once they get that advice and find those holes or areas in which they want to improve.
And one of the things I'm so glad you brought up our scope of practice and our roles because another part of it, which I am so interested in learning how you do this too with this clientele, specifically with this population, is meeting the coachee where they're at, right? In terms of even not even their goals, even before then, understanding what their diagnosis is and what it means. Because obviously there's so much medical, we use the word jargon sometimes that comes out. There's so much medical language and lingo that comes. And so, how to actually have that understanding. And again, you're not teaching, right? You're not advising, but you're providing resources so people can assess their own state of health. And so, for listeners, especially who may not be so familiar with multiple sclerosis, how do you end up describing it and supporting your clients into assessing their own state of health? And I apologize because I know I just stacked a couple questions on you.
No. So, how do you describe multiple sclerosis? It is a disease that affects your nervous system. So, you have lesions on your brain and or your spine, and they're detected through MRIs, spinal taps, blood work, just a lot of physical symptoms lead people to go get tested. Sometimes they have optic neuritis, and which usually resolves on its own once they've gotten some treatment. I heard this really amazing way to describe what MS is, and I'll tell that story if I can. If you can picture a cat and a lamp, the lamp is plugged into the wall via a cord. It's just sitting there, lights on, and all of a sudden a cat comes over and maybe nibbles on the cord a little bit. Think of that cord as, so the inside is the nerve fibers and the outside is like the myelin sheath in your nerves. And when the cat comes and nibbles on that cord, it might cause the light to flicker a little bit because now the signal is getting a little broken. And when the cat comes back the second time, maybe they go to that same spot or a new spot and they nibble some more. And all of a sudden they chew through the cord and the light goes out. Now it's not working. And so MS is much the same. It's a disruption or interruption in that nerve connection between your brain, spinal cord, and your body. If I could share some symptoms that people have, it can affect your cognition. So maybe depression, anxiety, memory issues. It can affect you physically. You may have tingling, numbness, foot drop is a big one, sometimes pain. A lot of people will experience some back pain. Things aren't working correctly.
I love the analogy of the cat nibbling on a cord, especially for multiple sclerosis, because when we learn it in medical education, it's such a difficult disease to diagnose because it could present as so many things, as you had just mentioned, some of those symptoms. And just like a cat nibbling on a cord, The same cat is not going to nibble on the same spot on that cord. And if you have 10 cats in a room, they're not, they're going to all eat differently. And so the way that analogy is, it's, there are symptoms separated by time and space. It's chronic neurologic disorder and this autoimmune disease that basically attacks our body's own myelin sheath. And the most difficult part about it is even just the diagnosis part of it, right? I know you see your clients at all stages throughout this, and so often people are diagnosed in their early adulthood, right?
Yes, it'll hit you in the prime of your life, and it affects women more than men typically. So it's pretty hard for everybody who gets diagnosed with MS because it's something that you really didn't see coming or didn't ever expect would happen to you at such a young age.
And then the difficult part is once your body starts having this autoimmune inflammatory response, then there's also that scarring that happens, which the name
Yes.
sclerosis. And so I think that's really so difficult about it is it presents differently in everyone. And even the time to diagnosis takes so long. So you might get people after they're diagnosed, especially if you're working with an organization, if you're coaching, but the stage that they had to go through, their journey to even get through that information is already such a long process.
It is. And Jess, you bring up a good point. Some people will say that MS is like a snowflake for each person because everyone's case is different. Everybody presents differently. Some people receive treatment and things go away for the most part. Others don't have such an easy time with it. And it's just different depending on who you are. And it may create a flare up or you may have a relapse too, which is a little bit worse. It just depends on your MS and what it means to you. And, it creates this perfect environment for a coach to come in and sit down and talk with people and help them through what it means in their life and how to move forward as best they can.
I know you had also talked about as a coach supporting people with multiple sclerosis or just anyone in general, right? Because being mindful, I don't want to label anyone by their diseases at all, but I know we're talking about multiple sclerosis here, so I just wanted to acknowledge that. You had talked about the learning points when you started coaching in this position. You had mentioned active listening. I thought that was really interesting because even there is this huge wealth of scientific knowledge that you had to learn. It's these innate coaching skills that really empower the transformational shift.
Yes. And the thing about MS or any chronic disease, you never know how it's going to affect you day to day. Sometimes I meet with my clients and, we're working on maybe a walking goal or a meditation goal or journaling or whatever it is that they might want to work on. Some people have one goal, others have 10 the whole time and everything in between. And all of a sudden you have a flare up or something, or you just don't feel well. And I really don't know until I get in there and actually lay eyes on the person with whom I'm meeting to know what it is we're going to do that day or talk about that day. And it's really important to listen and just help them to feel validated and understood and heard with their concerns for the day or for the week or month, whatever it is that they feel needs to be addressed.
So, being in that present moment and really bringing your authentic space of active listening with everyone that you're coaching.
Yes, you do a lot of listening and reflecting and holding space for each and every person.
How did you find, I guess, I know you had mentioned your life experiences earlier, at least some of them that brought you into coaching. What did you find in terms of your skills from coaching and then your life experience? What strengths or like characteristics were you able to bring from who you are as a person and all the things you've learned just through living life into your coaching to help support your clients?
Yes, it's a great question because I'm 49 years old. I have three kids. I have three teenagers. Oh my gosh, we talk about so many different topics and it just changes every day. But yeah, I've been exposed to a lot of different people in my life and I've always been one to take on a challenge and sometimes go in blindly, not being sure what's going to happen, but welcoming the challenge. And sometimes life isn't easy with all the different things that we all have to experience. And we don't always ask for the hand that we're dealt. But I really believe in resilience. And I really believe in resilience as a muscle that you strengthen through doing hard things. And, anybody can do what they want to do with correct planning and preparation and just confidence. It can be really hard for the folks with MS. The early stages, they're experiencing grief and loss for who they feel like they were, and they're trying to navigate where to go based on what their diagnosis is like, based on how the medicine is affecting them. That's another thing we can get to is their disease modifying therapies. Maybe somebody was a runner and all of a sudden they have foot drop and they can't really run anymore. So what does that look like for them to get their exercise in? Understanding that your diet is really important and the choices you make in your wellness world are going to make an impact. That's something that is within your control. So I guess for me, I am definitely one of those thinking minds that's constantly burning and churning ideas. I've had some background with some entrepreneurial endeavors and I believe in my people. I'm pretty good at finding their strengths and helping them see their strengths and using them to do whatever it is that they want to do. Because every person has a story to tell, every person has strengths, every person has weaknesses, but we can all live our best if we just kind of pay attention and try to figure out a plan moving forward.
So many things come up when you say that to me. When you say you believe in your people and you provide this space where they can build on their strengths, there's so much, as we discussed, with MS that's unknown. And so much for them that's unknown when you take into their whole person, just their lives. And so when you were talking, I was like, so many people still aren't even aware of what health and wellness coaching can do. Wow, there's someone who can actually help me strengthen my own resources or shift the way I'm thinking about things. And just these cognitive shifts shift how we experience life so much. Whether or not you have a health challenge or you're caring for someone or friends with someone who has one, knowing that there's someone called a coach who exists who can help with that is just, sometimes it's really hard just finding resources, especially in our healthcare system where they try to do the best they can. There's so much administrative constraints and time constraints and trying to find a doctor. And so it's really incredible the transformations you're able to provide and how much support you can provide as a coach.
Well, and you're right. The word support is what it's all about. I have a client who just went on short term disability, and for weeks we worked on how to get that process finalized. And it was really hard for this person because there were so many roadblocks. But by having a wellness coach to come in and say, keep calling them, keep calling your doctor, call your employer, find the social worker in the medical practice. That's who you want to talk to, or things like that, helping them just bounce ideas off of someone else and giving them the validation support that they need to accomplish their goals. Because sometimes it gets really hard and your thoughts are in your head, but you just need someone to talk about them with so you can have a little clarity. And, with a chronic disease like MS, again, it presents in so many different ways, and there are good days and bad days. And when you have a bad day, it's nice to have someone to help you through that. And we don't replace the advice of a physician or a medical professional, but we do support their advice. And I constantly ask my people, what did your doctor say? Did you tell your doctor about this? Maybe you should write this down so when you go to your appointment next week, you have all the information, you don't forget anything. Would you like to make a list together? Things like that. So they can go in as prepared as possible and get the most out of their visits as possible, because it can be really hard to maximize your output from a doctor's appointment when there's a lot going on and you might forget something really important.
So, really supporting that space of autonomy and to have a little bit of try to get control over something that you have no control over is such a huge shift in empowerment as well. And, like you had mentioned, the doctor's appointments also are extremely high stakes, right? Because maybe you get a neurologist follow up depending on where you live and if you have access to a neurologist. So just knowing that, according to the US Bureau of Labor and Statistics, as of May 2023, There are only maybe 9,300 neurologists in the US for a population of 330 million. And then of that, maybe 1 million in the United States have received diagnosis of MS, even though they expect many more to be affected by it. So that's a large amount that we are asking of these neurologists. And when I can't even imagine with all the things that come up with MS and all the unpredictable symptoms and flares that can come up. And you're talking about having one appointment, one visit with them to really have everything written down to figure out how can they empower themselves to navigate both that appointment and how do they support themselves even in between these doctors' visits.
Right. You're exactly right with all of that. It's a lot of pressure. And for some, they've been doing it for a long time. For the population of people with MS that I deal with, they've been doing it for a very short period of time. So not only are they experiencing symptoms, they're also trying to manage medication, manage appointments. They're trying to reinvent themselves in certain ways depending on how their symptoms present. And it's a lot to take on. And a lot of people work full time. That's another beast of burden for them because it's a lot to have to put on your game face every day at work. And not all employers know that their employees have MS. That's another thing that can be really hard for people to share with either family, friends, employers, coworkers, what's going on. And there are so many invisible symptoms that nobody would really suspect that there's something going on unless you told them. So it can be a lot to think about. And sometimes you need one person who's asking you the right questions and thinking about your wellness and helping you kind of straighten out your line a little bit.
For coaches interested in working with people who might be having chronic diseases or who have chronic diseases or autoimmune diseases or MS or anything really, or for doctors and for neurologists listening to this podcast, how would you describe are the ways that you best support the people you're working with who are navigating through MS in a way that, integrates and supports them with the healthcare system? Because you are a part of the healthcare team.
Yes, I would consider myself part of the team. I really only deal with my clients, though I'm not communicating with other members of the team directly. But for health and wellness coaches, we're here to help our clients just live their best life that they can and be the best version of themselves. And we're helping them with change. We're change facilitators, if that makes sense, behavior change facilitators. So there's a lot that you can do with your state of health based on the choices you make. And I remember with my father, he was always overweight and he had heart issues, kidney issues, lung issues, like you name it. He had so much going on. And he'd come home and his cardiologist would say, "You need to lose weight." And he would be lost. He had no idea how to go about doing that. And sometimes he had success, but it came right back on and he really just didn't understand it. And then he would get his kidneys checked and they'd say, "Okay, you need to not eat these vegetables." And it was the same list of vegetables that are really good for his heart, but now they're bad for his kidneys. And it was just so much information to process. And I always kind of thought if he had had someone to help him process after the doctor's appointment or between visits or just before a visit, just to help him process a little bit, it may have made him a little more successful with changing his behavior because most of his issues were the direct result of how he made choices with exercise, diet, stress. Stress is a big thing that I would say is a common thread for every single one of my clients. We always talk about stress. It has such an impact on any person, whether you have a chronic disease or not. It's really harmful to all of us. And it can be a hard thing to know how to deal with properly.
One of the other points is so obviously, you as a health and wellness coach are part of the healthcare team. As a coach, one of the things we also do is guide our clients to finding resources. And so, when you coach people who have multiple sclerosis, how do you encourage them or how do you support them in establishing or building relationships with their healthcare team? And are there other people that are involved in their care?
Yes. So, one of the first questions I'll always ask the folks that have maybe they have foot drop or a limp, or maybe they have some numbness in their hands. And I had one client who used to break glasses all the time because she'd pick up a glass of water and it would slip through her hands because she didn't have full feeling in her fingers. So, one of my questions is always, do you have a physical therapist? They're really helpful in taking a look at your entire body and pinpointing muscle areas that can help improve your situation. So I ask them questions like that. I try to ask them, when's the last time you discussed your medicine with your doctor? I'll ask them if they have a mental health provider in case they are really showing that stress is overwhelming. And pretty much every single person can benefit from talking to someone and having someone when they need it, either regularly or for when they need to talk to them. But I ask the questions. So I suppose that's my role with them, to ask the questions so they are thinking about it and creating awareness and using their resources when they need to use their resources. I've seen a lot of people that I've worked with make so much progress just by meeting with the right people. And with the overwhelm that comes with having a diagnosis like MS, you don't always think of those things right off the bat. We all have stuff that we probably hang on to for a long time, maybe a sore neck or your knee hurts, and you live with it for months or years before you talk to someone. Well, I'm there saying, hey, what do you think would change if you called this person? And sometimes I actually will physically look up the resources for them while we're meeting, and we'll do that together so we can find someone in their area who maybe hopefully specializes in working with MS patients, and I help them to get that part of their life a little bit better.
Thank you for sharing. I also know that the National Multiple Sclerosis Society has a lot of resources as well, which seem like a wealth of information for coaches, for providers, for everyone.
They do. It's an amazing organization and they do so much for their people and they provide so much. I can't say enough good things about them as an organization.
Sure. When you do meet with your clients, what do you find are the most common challenges that people with MS tend to face?
Having the time to do everything. Well, actually, and gosh, I feel like the elephant in the room that we haven't brought up yet that most people with MS deal with is extreme fatigue. That one is really hard because maybe they want to do all of these things, but you only have so much energy reserve in the tank to use for what you want to do or need to do. And if you're a mom or dad working full time and you have to come home and you have kids to take care of, practices, you name it, whatever it is that it is in your life, or you might have a job that's really demanding where you're working 15, 16-hour days. And where does your wellness come in? I would say every single one of my people, I always ask them, what have you done for yourself this week? What do you think you can do for yourself next week? Because it's really important to make space for yourself to take care of yourself. And we always learn that the mask that you wear on the plane when there's an emergency landing, you want to put your mask on before you help others so you can be more present and help more people. You put it on yourself before you would help the person next to you. So we talk about it's really important for you to be present in your loved ones' lives, to do everything you can to feel as good as you possibly can. And we take a deep look at habits and, okay, well, let's think about what can go in your world. Like, what are you willing to cut a little bit even so you can make space for something else? And that's where the deep awareness comes in for people because they usually have the time to do things. They just haven't found it yet. So, I was doom scrolling. We talk about that all the time. That's one thing that a lot of people find when they cut back on that significantly. They've just made plenty of time to do the things they want to do. And doom scrolling, really just looking through social media endlessly and getting kind of sucked into that trap. But Yeah, I mean, a common thread is fatigue and stress because there is a lot in your world that you have to now think about that you maybe didn't have to think about 5 years ago, and we deal with it. We figure out how to make the negative parts of their life as quiet as possible.
Everything that you've shared obviously is so relevant to everyone. They're universally human. And that's one of the things that's been inspiring about learning about your work and also just coaching in general is how, especially in medicine, we go from labeling by disease and pathology and kind of focusing on that, unfortunately, rather than the whole person or even, saying names during bedside rounds, especially on a busy service. And so to actually switch spaces where you, Liz, get to hold the space for people to be viewed as wise, whole, resourceful, and to basically navigate challenges that are universally human and have nothing really. I mean, yes, they came about. They're in this situation with this unfortunate disease, but everything you're talking about to me sounds relevant to everyone.
It kind of is. I mean, it really is. We're all busy people and forget about the basic needs that we have in our world of wellness. And it's different for everybody. Some people just crush their eating goals and exercise goals to the point they don't even think about it. But, they don't really have a stress reduction, maybe mindfulness side to themselves that helps for them to calm their brain. And maybe that's preventing them from sleeping well at night or something like that. So these are just basic things that everybody should and could be doing. And when you're dealing with this beast of an illness that has interrupted the flow of your life, it's kind of nice to look at because you can't control that you have MS, but you can control what you're doing to make your world as wonderful as possible. And that's what we do because the medicine does what the medicine does. But if you focus on what you're eating and making sure that you're making the right choices and getting your movement in and working on social connections, that's really important too. And having a rich experience with your peers and your loved ones, that makes your world a lot better. And we talk about those things all the time. I do also always try to talk to people about their support network and their social connections because not everybody has people to lean on or they feel guilt over leaning on them. They feel like a burden, and helping them to sort of lift up that curtain a little bit it can be really difficult. But when they do finally let people in and let them do things, then it feels really good and people like helping. That's just basic human nature.
I think it's also the independence that they gain through this work. It's freeing.
It is freeing and it's empowering. You want to go in feeling like, I got this. I got this. Yes. And I do follow up with my clients in between sessions often when they give me permission. Not everybody likes that, but some do like the check ins, and other people, I encourage them if they want to send me like a screenshot of their workout or whatever it is that they're working on, maybe a picture of a meal that they made that was super healthy. And I have that mama pride every time I see something really great that they've done, and I can just feel their energy, their excitement. And we're not moving mountains, we're just doing some simple things that actually have really impactful results in your life and make your world even better. Again, I think I've said that a few times, but you're making your world better by doing all of these things. And sometimes it's such a small thing. Every time I meet with any of my clients, the very first thing I do with them is create what I call them teaser goals. And they're meant to be really simple things that take very little thought and is about the easiest thing you can do, but it gives you a taste of doing something. And one of my favorite things that people do that always tends to stick and grow is wearing a fitness watch, whatever it is, if it's an Apple Watch or a Fitbit or a Garmin or any of those that people like to wear, just to wear one of those trackers so you get used to accountability and you get used to having to plan for what you're going to do. You have to charge it so you can wear it the next day. And then you get used to getting the notifications that it tells you if you've closed your rings or whatever it might tell you. So I love that when they get really into a goal like that. And then eventually it leads to them maybe tracking steps or saying, okay, I want to close my exercise goal every day. I'm going to walk for 10 minutes in the morning. And then they'll maybe send me follow ups about their walk that they had in the morning. I've gotten a few of those today already. Really funny selfies of my clients outside walking or frowns because it's raining and they're inside and now they have to walk around in circles in their garage, but they're doing it and they're being creative and finding ways to do it. And it's really, really fulfilling for me to see that hard work that they put in because they're making results and they're feeling good about themselves and they're helping their body do better.
Hearing you and the fulfillment you have, your passion, and the experiences that you've shared, the word that's coming very strongly to me right now is empathy, and how coaching, actually, by having a coach as part of a healthcare team, especially for a neurologist clinic, neurologist office, neurology department in a hospital, it's an expression of empathy because, like you mentioned, every day is a journey. And for whatever reason, even as a physician, you see so many patients and you have compassion, you have this human compassion for the people you're treating. But it's so hard to even process as a provider every patient's story because you just have to do so much work in such limited time. And so, what I'm hearing for you with coaching, that experience where you actually get to be there, they're sending you selfies and sharing their day with you, they're sharing their lives with you. It sounds like what came to me strongly was just for the like reframing it in this way was having coaches support providers in this sense is actually a huge form of empathy because you're saying, okay, you need the medical care. This is the best we can provide given the situation we have. But there are other ways you can be supported. And a health and wellness coach is such a valuable resource. It sounds like in an ideal world, if we had a magic wand, there should be a national board certified health and wellness coach in every neurologist's office.
It is quite valuable because we do our jobs so they can do theirs too. And they don't have time to be checking in on their patients to make sure that they're getting movement in a way that makes sense in their world. But a health coach can, and we do. That's the stuff that we do because we know that if you get movement in every day, then you're going to feel better. It does help a lot of folks with MS combat fatigue when they get some movement in. It has so many benefits in so many ways. So, yeah, we're there to figure out accountability in whatever shape or form it comes in so they can get done what they need to get done. And it's really fun, even after a coaching relationship has ended, when you get follow ups months later. I had one from the first cohort that I did with the National MS Society of one of my participants. She wasn't really exercising at all. And she would do a walk run kind of a couple days a week while we were meeting. And then months after we finished the cohort, she sent me a message that she just ran a 5K. And I was like, oh my gosh, that's incredible. Again, proud mama feeling. It's really cool to hear their success stories, and everybody's capable of a success story. I truly believe that. And I hope that, talking about empathy, I hope that every person I meet with feels my love for them because there's so much of it. And they're all so cool. They all have a story that's their own. And it's really kind of neat to be a part of that. I pinch myself every day because I can't believe that I get to do this with people every day. It's very fulfilling.
And it's amazing too, because they'll say, like, thank you so much for what you've done. And all we've done is hold the space because they had to do it. You didn't run that 5K for them. They had to do that. And so it's just by holding a little bit of space in the way that we get trained to as coaches, they get to access their resources and all this beauty happens. I wanted to ask, so usually when to wrap up, I will ask for a takeaway, but today 2 takeaways are coming, if that's okay with you. Just because this conversation is so rich. The first takeaway, so obviously, is what message would you have for coaches listening to this podcast?
Oh, gosh. For coaches, I know it's hard to find clients, but it really is important. I know they say find your niche and know who you are serving. And I can't stress that enough, because once you flip that switch and you're like, I think I know what I'm good at. I think I know the people that I'm good at. Like, I think for me, I really, whether it be MS or a different illness or any diagnosis, it could be anything, but I really like working with people when they're going in through that transitional period, because I just am able to process the information with them and help them to process and help move forward. But knowing that it took me a while to get there. And, you do have to try different things. But for the coaches out there, try some different things, be willing to meet with anybody or coach anyone, and maybe give it away for free in the beginning because you just need to get the experience. That's part of it too. But don't give up. Just keep on pushing until you find your spot, and then you'll have this amazing world of fulfillment.
The takeaway that came to me for coaches after our conversation was having faith in yourself and having faith in this process, just with your journey and finding this work and the experiences that led you to it, to be very transparent with you. Sometimes I want to serve certain populations or think about niching myself to them, but it's so personal. And sometimes it's like, if I'm not going through this, how can I connect with someone else who is? And there really is a lot of that, but I realize there's a lot of inner work as coaches we have to do in order to really put ourselves out there and support someone. And my takeaway from this is obviously always a humbling reminder to have faith in the process by having that space of doing what coaches do, holding that authentic space of listening, providing that safe, brave container. The transformation happens, and the transformation happens because of the people we are coaching. And so having that good intention. The second takeaway I was going to ask you for was, what would be your takeaway message, especially with your experience with coaching with people with MS, for healthcare providers listening to this podcast?
Oh, goodness. That's a good question for a takeaway. Well, health coaches are there to support their work as much as they're supporting the actual client or the actual patient. We are the behind the scenes people who are giving their patients the support they need to make progress and helping them find answers that can't be answered in a short period of time during a doctor visit, because there's just not enough time to go over everything. So we do provide some resources, and it can be anything. I always tell my people, we can support you in any area of wellness, you name it. We can talk about anything. So for the physicians out there, neurologists, it's really hard for these folks that they're seeing when they walk out the door of their office, because they've just gotten all of this information and they're taking it in, but they still need to process it. And the processing tends to happen outside of those doctor's visits. And it's really powerful to have someone who is invested in your wellness to help you go through it and help you figure out how it's going to work in your world.
So well said. The takeaway is we are all part of a team, and the goal is to support people the best we can. And so, my takeaway also, just from coming from that space, sometimes you feel almost hopeless because there's so much political, social infrastructure in place that we can't change. But there are support mechanisms in place, and coaches are available resources. And it's just raising awareness of the ways in which you can support doctors, support medical practices. And so I really want to thank you, Liz, for your time today, for helping to raise awareness specifically of multiple sclerosis and of some of the ways. I know we barely brushed into it, and you can probably go deeper into it, of the way that coaches can support people with multiple sclerosis or any chronic disease. Because the needle moves just by raising awareness and education and doing the work you're doing. So thank you so much.
You're welcome. And awareness is a really big piece of the puzzle, because you have to know what you want to focus on before you can do anything. And that takes a little bit of self-reflection sometimes. And the awareness that's a big part of it.
Absolutely. Thank you so much.
Thank you. Thanks for having me.
Thank you for listening. I appreciate you and value your feedback. So please subscribe and write a constructive review. If you'd like to be informed of new episodes and offerings and resources for coaches, sign up for our email list at www.centerforhealthandwellnesscoaches.com. Sending you warmth and light.